Ladies and gentlemen, it's past the hour of our meeting, so we'd like to get started. If everyone could take their seats, I believe we have quorum in the chamber now. So I'll call this meeting of the City of Hamilton Board of Health to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals in the media may also be audibly and/or visually recording this meeting. Madam Clerk, are there any changes to the agenda?
Yes, we have several changes. We have 6 added delegation requests added as follows: 4.3, Myrtle Grieve; 4.4, John Mills; 4.5, Katrina Gervais; 4.6, Dave Jerkewski; 4.7, Deidre Pike; 4.8, Peter Hutton, who has since sent his regrets to attend today, but he has sent an email with his comments, and those have been distributed. Also, item 6.3, Jim McLean, respecting the Good to Go food box. He has since sent his regrets and will be withdrawing his delegation. And we have an added item, 8.3, appointment of Associate Medical Officer of Health.
May I have a motion to approve the agenda as amended? Councillor Partridge, Councillor Pearson, all in favor? Carried. Thank you. Any declarations of interest? Hearing none. May I have a motion, please, to approve the minutes of August 14th? Councillor Collins, Councillor Morrow, all in favor? Carried. Thank you. Now, we have the delegation requests before us, and I'm going to ask for a motion to approve the delegation requests 4.1 to 4.8 and waive the rules of order to have them speak today before item 7.4, which is the report respecting the Good to Go food box. So, you move that, seconded, all in favor, carried, and waive the rules of order to have them speak today. We'll move and seconded, all in favor, carried. So, yes, Councillor Partridge.
Yes, thank you, Mr. Mayor. Just a point of clarification, if I can, to Madam Clerk through you, is the 8.3 in the yellow copies different from the 8.3 that was emailed to us that is now in my binder? Is there any difference?
No difference.
Thank you very much.
Thanks very much. On consent items, we have healthy babies, healthy children. We have communicable disease and health hazard investigations. If there is no discussion on those consent items, could I have a motion to receive them? Councillor Johnson, Councillor Pearson, all in favor? That's carried. Thank you. And 5.3, choices and changes and other funding grants budget. If there's no discussion on that item, a mover and seconder, please. Pearson, Johnson, all in favor? Carried. Thank you. Item 6.3, as we've said, has been withdrawn. Our delegations will be heard before 7.4, the report respecting the Good to Go box. So now we're on to presentation. And for presentation item 7.1, I'd like to call upon Brenda Flaherty, the Executive Vice President of Operations, Hamilton Health Sciences, Dr. David Higgins, the President of St. Joseph's Healthcare, Hamilton, and Jim Williams, who is the lead physician, Hamilton Family Health Team. Joining us at the podium, ladies and gentlemen, welcome. Is there a doctor in the house?
Thank you, Mr. Mayor.
Welcome.
Councillors. We'll get my technology organised here. Thank you very much for having us to Council today, to the committee today, to present on Health Links, a very exciting initiative driven through healthcare in the Ministry of Health. This is an initiative which I'll explain as we go along, designed to focus on partnerships to deliver care to the most needy clients, patients and citizens of our city. It's critical that this initiative focuses on working together across all the sectors to deliver care to our citizens in a more effective manner. And before I go further, I want to hear first of all from some of our citizens who I know will have a significant impact on what we say. So let me just get the technology for you now in a video.
Healthcare can be complicated. Many people experience system barriers, leading to a sense of powerlessness and lack of control. While Canada's healthcare system is one of the best in the world, people still find that they often have to go to great lengths to access the care they need.
What matters to me is accessibility. I like to be able to go places when I want to go places. That's what I want more than anything.
What matters to me is a matter of equality. The government, everybody needs to treat human beings as equals. A user, a non-user, old, young, crippled, crazy, it doesn't matter. We're all the same people. We deserve the same kind of health care.
What matters to me in healthcare is to have a healthy me so that I can have a healthier family and a healthier community.
So what's really key here, well, while the technology is setting itself, and to move on to the slides, is that the HealthLinks philosophy is designed to bring the sectors together. And I think on your blotter you'll see that within the HealthLinks projects in Hamilton, we now have 41 community agencies, including hospitals, CCAC, the McMaster Family Health Team, to work together along with the city to devise a programme of care for those most in need. Directly from the Ministry of Health's website, HealthLinks is designed to provide coordinated, efficient and effective care to patients with the most complex needs, that is our citizens. And you can see here before you logos of key organisations plus 30 other organisations spanning community social services, community health services, home care, government agencies and more to provide this new project. Well, the question is really, why is this important? In Hamilton, we have 3 HealthLinks. I'll define what they are in just a moment. And you'll see in the purple is HealthLinks East, which is Hamilton East HealthLink, which is St. Joseph's, led by St. Joseph's. On the blue, you'll see Hamilton West HealthLink, led by Hamilton Health Sciences. In yellow, you'll see the Hamilton Central HealthLink, led by the McMaster Family Health Team. And in Hamilton, we've felt it's really important not to have isolation here, because our patients, our clients, our citizens are of one within the city. So we've come together as a Hamilton tri-link to work together. So bring all these agencies together to provide care to the most complex patients with the most complex needs. Why is this important? Well, this is really important because this is where the ministry is coming from. This is a really rather shocking statistic. If you look at this, 5% of the population of Ontario account for 66% of all healthcare spending in Ontario. That number is quite staggering. The bill for healthcare in Ontario is about $50 billion, B for $1 billion, and therefore patients with the most complex needs require 66% of that large amount, about $34 billion. What's really tragic, though, and these patients need care and these citizens need care, however, they often don't receive the care that makes the best outcome for them. They're often not well served in spite of being connected with multiple agencies and most of them having a family physician. So the goal of this process is to improve the quality and experience of care and to contain these rising costs, which can then be diverted to other pressing projects in our communities and our province. So where do we start? This seems like a large elephant to take a bite from. Where do we start? Well, what we've done in Hamilton across our 3 HealthLinks is bringing these teams together that I've illustrated to you already. We've found 1,000 individuals representing a section of the top 5% of emergency department users and hospitalizations. So we've defined a population of high-need patients as defined by needing to use ER department, EMS department, for example, and hospitalizations frequently. Their major diagnoses include severe lung disease, heart failure and diabetes. About 60% are over 65, but note 40% are not. They're under 65 and some of these are children. And there's a significant number of these clients, these citizens, with significant addictions and mental illness. The key thing is that we redesign and reconfigure our systems together to learn from that, make changes across the entire health sector and community, and make that change for the rest of the population. It's a really, really important project. Why is this important? Again, you know this at this committee, I think, better than I do. You know the factors that shape our health are not simply the healthcare access, doctors, drugs, tests, hospitals. You know that 50% of the factors that shape our life are our life itself, our income, our disability, our education, social exclusion. The list goes on. And this committee, I know, is very well aware of these issues. 25% of the things affecting our health care, our health, in fact, is healthcare. Not 50%. 50% are biology, and 10% of is our environment. Again, you know this at this committee. So, therefore, this is an opportunity to ask our citizens what matters to you, and work together as a community in the healthcare sector and our city and our agencies to understand how to make a more coordinated approach to this. I'm going to now pass the floor to my colleague Brenda Flaherty from Hamilton Health Sciences to take us on and hear from our citizens and suggest what we should do. Brenda.
Thank you, David, and thank you very much for the opportunity to be here this afternoon. And as David said, leaders in healthcare cannot do this alone. And as you can see, the blue part is really what traditionally healthcare leaders are accountable for. And we know that the health for our communities is about much more than hospital beds and medications and treatments of disease. It's very much a small part of a large picture. And while the discussion about the social determinants of health is not new in healthcare, we've been late to find ways to make changes to our system. We have to bring our social and health together to really make a difference for the people that we serve together. While we'll need to continue to improve how we care for our citizens with acute illness, and I can assure you that we're going to continue to improve at all times, we actually know, and we've learned from these individuals that are high users of our healthcare system, is that what's most important is for them to be supported at home, to feel safe in their community, and have a sense of belonging. And these issues are a key part of the Health Links vision, and we believe we have a shared mandate and opportunity to do this together. We're certainly, I think, in a unique situation in Hamilton. We have the ability together to transform the care in the way that it's organized and deliver. And certainly we all want to have a prosperous and healthy community. What Health Links is ultimately about is actually about the people and the citizens that we serve together. And we need to ensure that the needs of these individuals are met. And I know that you're interested in the social services in the city, and we would like to work with you to continue that. So you heard from Frances just early on. And Frances, we know, values accessibility. And she had trouble accessing her employment insurance following her leg amputation. So often we could address the medical issues in hospital, but there needs to be a healthy foundation of accessible buildings and adequate income supports. And part of actually the Health Links vision, and which is a very important part, is about secure housing, income security, and of course other social determinants are acknowledged and addressed. We also heard from John, who values equality, and he had a very difficult time finding a family physician because of his past use of narcotics. And those with addiction or mental illness may perceive care as shaming and blaming. And so opportunities to connect with other supports is very important to John. And Tara, she values her own health care so she can support her family. Like Tara, many people and families see multiple providers in healthcare, and with no single provider taking responsibility for coordinating her care, it can be very difficult for people, and we know that we need to do a better job at that. You didn't hear from Margaret. Margaret is from Hamilton, and she is an individual who is actually afraid to go home. She has some chronic disease, and she's nearing the end of her life. And we know that for many of these individuals who have addictions, our health system is extremely difficult to navigate. So these individuals, of course, present to the hospital in crisis, and their experience is unfortunately episodic, disruptive, and disjointed. So what we'd like to just talk about today is that together we very much believe there's great opportunity. So already the city is participating in the community of practice for system navigation, and Brent Browett is a key HealthLinks coalition member. We know that exploring ways for hospitals and primary care to be more involved with housing and income security is important. We also know that the community is leading the Neighborhood Action Strategy, led by Paul Johnson, and Paul and Elizabeth Richardson are on the HealthLinks Advisory. And of course, we look forward to working with Hamilton's plan for an age-friendly city. So from a community agency point of view, we know that housing, city mental health outreach, paramedic services, community paramedic programs, social navigator, Ontario work case managers, we need through HealthLinks to have collective ownership and work together. As we looked at the needs of our people in Hamilton who use our healthcare system often, and it's that 5% that David Higgins was talking about, there are two major needs for these individuals, and we're working with multiple organizations across the city to look at ways to make it better for individuals that are frail or palliative care or older adults. And the other, of course, is individuals with addictions and chronic illness. So if we focus on transitions, so improving the way that individuals leave the hospital and go to the community, self-management, which is all about the individual ensuring that their plan meets their needs, and secure housing, we can do a much better job to meet the needs of these people together. As I mentioned, it's very important that the individual, the person, the citizen drives their care planning and their needs. We need to bring health and social systems together to collaborate, to meet their needs. And of course, and I know the city's been very helpful with this, to ensure that they have a family doctor to meet their needs. So in closing, we would like to say thank you on behalf of the HealthLinks team, which, as David pointed out, is numerous organizations. We wanted to share with you the philosophy of HealthLinks. We would like to ask that we could continue to partner and work together with bringing our health and social services together and really be involved in the very important strategies that the city has identified, which of course is the Hamilton's plan for age-friendly city and looking at income security and housing. So we would be happy to answer any questions. I think we've learned as healthcare leaders that the social needs are in fact more important than the acute care health needs that we meet, and we would like to work with the city closely, and we look forward to it. Thank you.
Thank you, Brenda. Thank you, Dr. Higgins and Dr. Williams. I have Councillor McCaddy and Councillor Ferguson to ask questions. Go ahead, Councillor McCaddy.
Thanks, Mr. Mayor. Thanks very much for that presentation. To me, what you're talking about is a fundamental shift in the way things are thought about, and a very strategic approach, which we have to continue to do in the absence of new healthcare dollars over time and that sort of thing. But I think the social determinants of health approach is exactly where we need to go, where we have been going. I've sat on the Poverty Roundtable the last 8 years now, Tom, and we took that approach right from the beginning, and I've been putting things together, and you've been involved in that, HHS St. Joe's. So, in talking to Rob McIsaac, I know he likes this approach as well, but I find myself sort of wanting to follow this approach, and the partnership is critical with the city, and we're right with you on that. But it seems to me that the funding, that the historical way funding's been provided has been largely to the hospitals, to the, I'll call it the end of pipe, drawing on my environmental background in terms of how you clean up ecosystems, and not on the preventative side, or, you know, which is to me is social determinants of health are more preventative and trying to help people before they get into the hospital, before they, you know, before they have COPD and all those kinds of things, you know, the smoking issues and all the kind of things that the public health works on. And I'm involved with housing in Hamilton as well, which is vastly underfunded, hardly funded at all. We've got a housing and homelessness plan that's all costed out, the best thought out plan in the country, no funding. And I'm talking about the federal and provincial governments specifically. So how can we shift, how can we encourage the province, Mr. Mayor, to shift the funding that they currently provide to hospitals, make the significant changes? There's a lot of infrastructure in our hospitals that'll have to be, I'll be drastic, I'll say shut down, and that money redirected, because we know there's only so much money around to housing, to active transportation, to smoking prevention programs. You can go down a long list that you would provide if you took a social determinants of health approach versus the end of pipe hospital approach, which has not been working. I think that's why you're here. And can you help us with the province and with the federal government to make that shift, send us housing dollars instead of hospital dollars? I think it's going to take that kind of shift. Otherwise, we're going to say, you're bang on, we're bang on with our plans, but it ends there.
Comments?
I'll certainly start, and then yeah, we do, because you're spot on. So first, I guess the first thing is that certainly we know Premier Wynne has said, and over maybe 4 to 5 years, there has been no increase to hospitals, and that the investment of the Ministry of Health is into the community, of which we agree in hospitals, because we know, for example, that about 18% of our acute care beds have people that should be elsewhere in supportive housing, in retirement homes, but they can't afford it. And so they're in the hospital. So without a doubt, if we work together to apply for some provincial and even LIN funding, so much of the additional funding now is about the community, and that's why we do need to work together to look for opportunities within our city. And I certainly know even within the Ministry of Health now, they have a priority of supportive housing. So we do need to work with the province, because that is that's a critical component of health links or homelessness or poverty. We'll have to work together.
Anyone else? Jim?
Yes, I represent the Hamilton Family Health Team, and I think for the most part that health team kind of flies under the radar in the city, and because of health links, the profile has been raised a bit, and we continue to hope to increase that profile. We represent 150 physicians and 250,000 patients in the city of Hamilton, and the government has invested $20 million in the family health team to allow us to do exactly what you're asking, to move upstream and work on prevention, trying to help people in terms of preventing hospitalization and ER visits, both in terms of illness prevention, but also in terms of managing chronic disease process at the primary care level, inpatient homes and inpatient communities. And we're very excited by the city's community approach, because we believe very strongly that health care provided and delivered within the communities in which people live is a key component to that, particularly in the areas of prevention and palliative care, advanced care planning. So the government is investing in the city. We're hoping to show that those dollars are well spent, and I think a continued move in that direction is going to serve the citizens of Hamilton well.
Thanks very much.
I would just thanks very much for those responses. That's heartening to hear. I can just tell you if it's from one fairly narrow, well, it's 7,000 units of housing, city housing, Hamilton, across the city. A lot of folks that are probably your patients. We have next to zero supportive housing dollars from the LHIN, for example. So there seems to be a bit of a disconnect, the kind of things that you're hearing and you're receiving funding from the province or the LHIN perhaps. It's not coming to us. I'm not entirely clear why that is. But I think your comments today provide us, I mean, we should be going to the LHIN together as housing and saying, look, our folks are probably ending up in the hospital and stuff, and they shouldn't be there, and the supportive housing dollars that we need will keep them out. So that's just one example, and love to have that conversation.
Thank you very much. Go ahead.
Thank you, Mr. Mayor. Just to respond further to your comments, Mr. McCarthy, I think what's really exciting about being in Hamilton today is I agree with you. There's a disconnect in the funding streams. There's no question about that. But I think we have the credibility in Hamilton with the work this city has done already. We've got two great hospitals. We've got a family health team, a McMaster family health team, a great university, Mohawk College. We've got the infrastructure, credibility, and organisations here to provide a very credible voice centrally, at the provincial, and maybe even federally, to really change this. So, but I do think we have to show results first, because I think I believe what we're doing through HealthLinks is that opportunity to show us what could be possible. And that we're moving forward in the projects Brent has described. I think then together as a city, I believe we can move forward to do just what you've said, to lobby, to advocate, and to be credible. Invest in Hamilton because we can deliver results.
Thank you very much. I have Councillor Ferguson.
Thank you, Mr. Mayor. Mr. Mayor, it's not very often we get the top executives from healthcare providers here in our council chambers, so welcome and thanks for coming out. When I saw healthy links as the topic, it made me think, and Brenda, when I was at Hamilton Health Sciences on the board, we talked about getting electronic links for test results. And I thought we were close back 4 years ago. I know eHealth crashed and burned, and Hamilton Health Sciences is trying to set up its own, but still in this electronic age, if you go to your family doc and get some tests done, and you go to a specialist, they have to have them redone or try to get them from the family doc, then go on. But even at home, you want to look up your cholesterol test results or your A1C or even your pregnancy test. You want to go on, put in your health card number, put a password in, and look at it. Are we any closer with this? It seems so basic in this day and age to be able to electronically move this information.
We're not just closer, we're there. Within the last month, my office in Dundas has connected with a provincial network called OLIS. All the private labs and hospitals in the province upload their lab data into that system, and then the hospitals, emergency rooms, physicians' offices can pull that information down. We're not quite at a step yet where the lab work that's done in my office, some of that doesn't necessarily get uploaded, but if they go to one of the main private labs in the city of Hamilton or to a hospital lab, all that information is available and exchangeable.
So if one of your patients went on a website, whatever it is, and put in their health card number and a password, can they look at their own test results yet?
No. But that's also, I mean, the privacy commissioner and privacy issues have made that process a little bit more difficult. But in the family health team, we are looking at what we call patient portals into our electronic medical record system. I believe that the McMaster family health team is already providing that to their patients through their electronic medical records. But it's very close to a point where all, and the vast majority, I think over 90% of family doctors in Hamilton are using electronic medical records. There will be the availability to have portals open so that patients can access their records remotely.
See, you can't see in the near future where a patient could go on and look at his own results because of privacy issues.
Well, I think that it's not the privacy issues are obviously not between the individual patient and his record. It's building a secure system so that the patient is the only one that can access those records. And that technology, I mean, obviously the technology exists. It's a case of incorporating it into existing systems and
Right.
Brenda has something.
No, and just picking right up on what Jim said, it's a case of money. So we have the systems, we can do it. It's finding the one-time money to build the system, and then so we have worked through the issues. It's a question that I ask often of our Chief Information Officer and Chief of Technology, and it's a matter of cash.
Okay, because on the privacy issue, I can go online in a few seconds and be moving my money around. So it seems a stretch that I can't go online because of privacy issues and not look at my test results. I don't know who else, quite frankly, would be interested in them. And so the province on the money side, then, the province has given up on having us a province-wide electronic database where any hospital, any specialist, any family doctor, any patient can go online and look at these results?
Well, I don't think they've given up on that. I'm not totally up to date with all the e-health, but I know OLAS, the uploading of lab data is a first step. There's also a system in place for most X-ray radiological data is all going into a central computer, and then that can be downloaded across the hospital systems. We have Clinical Connect in our LIN, which links family doctors' offices to all the in-hospital reports and specialist reports. So communication amongst the medical professionals is improving. The link between those records and patients, as far as I'm aware, there's only limited places where that's happening now, but I think that that's certainly something that's on the horizon and not in the too distant future.
It's got to be expensive to have, no, I'll be quiet, Mr. Mayor. It's got to be expensive to have every patient calling their doc and having the doctor have to look up the record and read it back to them, and they simply go online.
Well, we agree to the extent there's often a little bit of interpretation of that record that's an important component of it, but I think the money is an issue, and it seems that the financial returns of banks are a little bit more than the financial returns we have in the medical system, so that may be part of the problem.
Can't argue with you there. Thanks, Mr. Mayor.
Thanks very much. Councillor Collins, would you take the chair, please? Thank you. And I'll point out to this slide, which is so informative and fascinating, factors that shape our health. And so we get a lot of bumper sticker stuff on health, like the code red. If you live in the corner of this street and that street, your life expectancy is 28, but if you live in another place, your life... This is really the stuff where the rubber meets the road. And so my direct question on this would be, is there any correlation yet between our neighborhood groups, and Paul Johnson's here, I know, listening intently, Paul, and I see where you have Let's Get Together, the groups that have formed around distinct populations with the greatest needs, frail, palliative, and older adults, addictions, and chronic medical illness. But would there be some value in a relationship with our neighborhood groups reporting or receiving reports on general health issues in their smaller areas? Is that something that you could see could be done, or is that honing it to too small a group?
No, Mr. Mayor, that's perfectly possible. We would work very closely with Paul and his teams in the neighbourhood strategies to see what the citizens needed and wanted and would fulfil those needs. So that's perfectly possible, and I think that we would do that within a heartbeat.
All right. So, Paul, you make a note of that, and I'll take the chair back. And I understand, Councillor Morrow, you're on the same. Mr. Mayor, could I just? Yes, please go ahead.
Yeah, I think that obviously Paul's aware that the Hamilton Family Health Team, and I believe the McMaster Family Health Team, are already doing that. We have a program in the McQueston neighborhood that was jointly funded by our Family Health Team and the City of Hamilton. We have been in conversation with Paul about a project that we're beginning to, or hoping to embark on soon in the Dundas portion of the City of Hamilton. And we have already looked at plans in several of the neighborhoods that Paul and his team have built an association with.
Oh, that's great, because as you know, we've been doing some great work on the sort of the built form structures, parks, and so on. But but here's something that we could, I think, really see some advantage in. So I have the chair back, and I'll send it over to Councillor Morrow.
Thanks. On that point, I represent the area from Wellington to Ottawa for this year, and the General Hospital, whatever the name is now, has begun to reach out into the community. I sat beside a woman, Vice President, I believe, at our last Barton Village BIA meeting, where she is now a member of that. That never happened before. It was the hospital was referred to as the local fortress, without any interaction, and people went there and worked and then went back home to wherever they lived. They're now in the community. I believe the Gibson-Lansdale Association is also benefiting from direct participation. So any way that can be further opened up will be very, very good for the community, along the lines of what you've said, Your Worship. So I appreciate that very much. I know the people in the neighborhood do as well. I have another point at appropriate time. I don't want to be inappropriate or too personal, but Dr. Higgins is now, of course, known for his administrative talents. Previously, as a respirologist, he diagnosed and treated an ailment that I had during a very serious health challenge about 15 years ago, and I know literally prolonged my life. So I've never really had a chance publicly to say not all would want to say thank you, but I wanted to say thank you now. I'm so glad to see him holding forth in the ways that he does, along with the other people here today. Here. Thank you.
That's awesome. I wondered if I could comment.
Go ahead, Brenda.
Certainly, the neighborhood strategy we learned from maybe some best practices. David and the city and others, we went down to Chicago in a very high needs area. And what we learned, which is of course what we learned from Paul Johnson and the people in the neighborhood strategy, is you have to reach out to those local neighborhoods and have people that live there pull people into the healthcare system that really need it. It can't be the traditional healthcare system. It has to be people that they trust in the community. I know all of you knew that, but we certainly know that. And as an ACRE organization, and we mentioned Mohawk College and McMaster University and St. Joe's and Hamilton Health Sciences, Mr. Morrow, that's exactly why we have Teresa Smith has such an interest, because, you know, now we're involved in community gardens and Habitat for, because we have 12,000 staff who can volunteer and be part and give back to our community. And that's actually why we made the decision and with the help of understanding that where our Shadok site, people live to be 86 years old, whereas down at our Hamilton General site, they live to only be an average of 64. And so that's why we're building our McMaster Children's Treatment Center down at the site of the Hamilton General, so that's more accessible to people that actually need it more and may not have the resources to get up to the Shadok site. So by working together, we learn a lot more about the social and health needs of our people we're serving together.
All right, seeing no further speakers, I'm going to thank our presenters today. And I'd like a motion to receive the presentation. Unfortunately, we're short on quorum. So we'll excuse our speakers, and when quorum returns, we'll be able to formally do that. So thank you very much for the presentation today. And in the absence of quorum, though, we can still call on Dr. Richardson now to the podium to provide a presentation. I'm just going to ask for a moment's recess while I see if I can find quorum.
Moment's recess.
We now have quorum, and I'd like to 1, 2, 3, 4, 5, 6, 7, 8. Oh, okay. All right, Sam. We now have quorum. Can I have a motion, please, to receive the previous presentation? Councillor Collins, Councillor Morrow, all in favor? Carry. And now I'm going to ask Dr. Richardson to take over.
Thank you, Mr. Mayor. I know Chris Murray went over at GIC yesterday a presentation on some of the accomplishments over the last term. We had a similar idea, I think, at a similar time. And so if you'll indulge us, we did want to go back over some of the things that have been accomplished during the last 4 years with the Board of Health. It's a really, one of the things I remember a member of the media commented on public health services being somewhat dour. And so just to show you that we do have a celebratory side as well, and looking back at some of the things that have been accomplished over the year. But also it's a useful time of year. This is a time for us where we plan and in terms of moving forward, and it helps to look back at what's been accomplished. Think about some of the things that have taken us a long time to get somewhere, and that is the nature of the beast. It was that way 100 years ago for our colleagues in public health and boards of health then, but also to then think about some of the things that are before us as we move forward. This was how all of you looked back in 2010. Did want to take a moment, of course, to recognize Councillor Morelli, standing then beside the Mayor, and now Councillor Morrow, who is here in his stead, and the contributions he made. He did, of course, push us within public health to think about things differently, and really championed many of the ideas around teen pregnancy and the issues that affected his ward. And you'll see, I think, some of those come up as we go through the presentation. So what did we all look like from an organizational standpoint back in 2010? It was our first full year that we had become 5 divisions instead of 4. We had started a clinical and preventive services division, bringing forward programs like our dental treatment programs, our sexual health clinics and vaccine preventable disease programs to put a greater emphasis on some of the clinical services that, frankly, within public health units don't always get a lot of attention. And to position us better for partnerships like you've been hearing from Brenda and David with people like the hospitals and whatnot, but also to bring greater synergy within those programs. We had our new standards that we were following, and we had now had the city values and the city strategic plan in place, and we were figuring out how we fit into all of those. We had our 2010 work plans at the time, and it was one of the first years that we had brought those more formally to the Board of Health to get feedback and input into them. And I can remember Councillor Jackson saying, hey, you know, I think you might be missing out on a few things, and it really helped us to shape our business. And at that time, we were working out of 18 locations. We are no longer in that situation, down to about 7, and we definitely have you to thank for that. Over the term, we considered 202, or I should say you considered, we brought forward to you 202 staff reports. So you thought you had a lot of reading over those years. We can confirm that that's the case. About 50 to 60 per year. And what did we accomplish as we went through those? So I'll just take a look at those things. We had an increase in our staff within our child and adolescent services complement to bring about greater service to kids, to reduce wait times and increase capacity for service to some of our most vulnerable in our community. And I think you'll see that as a bit of a theme as we go through. There's been a real focus on those who are vulnerable within our community. Our best baby-friendly initiative, we brought forward new best practices. This is one of the things the ministry looks for and has an accountability indicator for. Brought through new policies to support breastfeeding within our community, within the city itself as well, so that it becomes more of the norm within the community. We implemented the Nurse Family Partnership Program. So this was a real change for us. We had Healthy Babies, Healthy Children's protocols, which laid out from the province what it was we were expected to achieve. But working with McMaster University and with David Olds out of Colorado, I should say, it was recognized that maybe it didn't provide the best service for those who actually were most in need, for young mums who are of low socioeconomic status, who needed more help than the Healthy Babies, Healthy Children program could provide. And so we worked with the ministry, we worked with David Olds, and we began this program as a pilot initially, and we were the first site to do so in Canada. Lo and behold, we had really good uptake, and we found it really did make a difference here as well. And so we continue to run that program through 2011, and indeed had an enhancement to the program in that year. The Community Climate Change Action Charter came about in 2011 as well. It was endorsed and signed by Council in 2011, and we were the first municipality in Ontario to have such a charter. And you're going to hear more about climate change and those sorts of things as we go through this. Also, on the air quality front, we were the first to have a cooling tower bylaw. If you remember going back to 2006, actually, when we had our first outbreak of Legionella that was recognized, and realized that there were some issues. Legionella is ubiquitous out there in the environment, and during construction season and in the summer when the cooling towers are running, we realized that we seem to have this yearly spike. And we were one of the first organizations to see that and recognize it. And Public Health Ontario and the Ministry has since put in place recommendations to follow suit on many of the things that this council brought forward when they asked to have the cooling tower bylaw put into place. Our new municipal tobacco bylaw. So this, of course, caused some controversy and some consternation over the years as we went forward. But tobacco remains one of the leading causes of death and disability for our community. And so back in 2012, in 2011, there was the debate. 2012 was the implementation. This bylaw came into place, which made our parks and community spaces smoke-free for children and families, so all could enjoy without being exposed to tobacco. Of course, it's not the only area. Tobacco being that leading cause deserves some other mention as well. We do really good work with our youth. We have some tremendous individuals, and it's a wonderful way to engage with youth and develop leadership opportunities with them. Our Unfiltered Facts program, our summit that we do with them, they're always inspiring to go and speak with the youth as they're presenting in those conferences. You heard about the health links and how we are looking to work more closely together. And one of the things was this partnership with the Hamilton Family Health Team, where we had a liaison to work with them in their child health and other services to improve the resources, the understanding of the social determinants amongst their health professionals, and improve their quality of work. The dental bus. I don't know if you remember it sitting out here just in front of City Hall. And again, this was something we had an old HSR bus that was donated from HSR over to Public Health, and the Rotary had given us $100,000 to retrofit it, and it became a community health bus. Initially planned to have broader services on it, including our sexual health clinic services. Turned out not to be such a favorite spot for those services on the community's behalf, but they certainly did enjoy the dental services that were there. And so with the launch of the new dental bus, we put in place 2 suites and doubled the capacity to treat in the community, because we had lineups every day at that bus. And so it has been a success. It has state-of-the-art X-ray facilities. It has now AODA compliance, so it's accessible to the public, so people can really utilize that bus, and it continues to enjoy a high level of service and demand from the community. The Skinner inquest. We can't go through this term of council without remembering Christopher Skinner, the youth who died of alcohol poisoning, and the inquest that followed. And from that tragedy, there was development of some resources to help parents when they're dealing with the issues of alcohol use and risky behaviors with their teens. And of course, it goes beyond alcohol when we're talking these things, to drugs, to other behaviors, and how it, adolescents who feel immortal, how we can work with them to address those things, and work with parents who face many of those challenges. And I can tell you, as a parent of a few teens, I can certainly appreciate the challenges that are there. There is also at your spot some other alcohol-related swag, as they say, and this is our latest piece about alcohol that's out there. It's called the Got Your Back campaign. It's a social marketing campaign aimed to Mohawk and McMaster students. And that indeed, as we went through this term, we recognized that was a group of students that we were underserving. And so we've been consciously doing some work with them. And this is reinforcing them to think about alcohol, how it affects their friends, how it affects their social relationships, and to reduce binge drinking. And talk to them about it's not really about the alcohol. It's really about your relationships and about how you support your friends. That had come back to community climate change and air quality, and here we are back again, and it'll come forward one more time. But we did begin our community climate change action plan in 2013. Started to launch that work with a number of people across our community. And of course, in 2013, late 2013 was when you received the reports of the Air Quality Task Force, which had been a suggestion as a way to move forward. We based that with Clean Air Hamilton, and there are about 8 recommendations to make improvements in air quality. Our nurse network or navigator, you've heard about that a little bit in HealthLinks already today, but this really, there was a real burgeoning of new people and new positions around navigation and helping people through the system to meet the sort of issues that you just heard about. And we realized that we needed to think about how we did all this together and not have some new duplication going on, and what were the best practices for navigation. And there's lots of people who'd been doing this for a long time. And so Brent worked with the different agencies and have brought together about 65 people from across 20 agencies to look at how they're doing this, develop best practice, and to push the system to improve in terms of how it is serving people. So it's been a really good initiative. We did, of course, move into Robert Thompson, giving us better service infrastructure downtown. So we now have our state-of-the-art dental clinic downtown, more accessible to individuals in addition to the dental health bus. And of course, with McMaster coming online, we'll have for the first time in I don't know how long our own downtown site for a clinic to serve people with everything from sexual health issues to DB to immunization programs, all of those sorts of things. But not only that, it really meant a difference in the way we provided service. We've looked and implemented a mobile workforce model. So our staff, so many of whom were spending time in the community anyway, now had a new way to work out in the community. Less time to be back in the office, less need to be back in the office, more time spent on client-facing services outside. And as well, it gave staff the environment they've been looking for. You heard me talk about cold and air quality issues and space issues and all the many things that had arisen in our facilities over time. And I have to tell you, you'll hear a little bit about a file review we did. And a couple of staff came down from, or a few staff from the mountain who have not yet moved into our Robert Thompson offices, came downtown. And they've been a bit full of angst about what this move meant for them. And, you know, they kind of liked perhaps where they were, and maybe it was a closer drive to home. Well, after a few days in our new offices, they are very happy to be coming downtown and want to know when they can move to that mobile work, and could they just base it out of Robert Thompson now. And so it's really been a huge success, and we're very appreciative of the fact that you've given us this opportunity to do this. Healthy Birth Weights Coalition, this has been one of our priorities that you've seen in our plan, and our objective is to strengthen our community by supporting healthy lives and healthy relationships for moms, babies, and neighborhoods. Again, about 50 members from more than 30 organizations. Those low birth weights are much lower in areas of low socioeconomic status. And we've taken a direction from those neighborhood planning teams. This is where you start to see that integration across all of the services, and the neighborhood action teams are putting forward recommendation, looking at how we can better navigate through the system to support these mums and babes, better tools and education to support them. And there's a focus in this initiative right now on smoking, on teen pregnancy, and education and supports during pregnancy. No, we didn't buy another bus. There is just the wrap that was put on an HSR bus, which is about the red, yellow, green signs that were asked for by this council for our food services, our food safety program. And of course, this came about in March 2013. This was approved, and they've been implemented now this year and are available at the door for the restaurants themselves. And again, there's that more detailed information available on the food safety zone. This was another initiative from our injury prevention program around brain injury and death. And there was a report that was asked for. I think we had asked for an endorsement of a letter that was going to the NHL about head injury. And some member of council, I can't remember which at the time, wisely asked for a report about, well, what was this particular issue? And, you know, we gave you an overview of it. And some of the things that have been coming forward around head injuries continue to be focused on the bike helmet issue, and looking with McMaster Children's Hospital, Hamilton Police Services, and the school boards, as well as many others, to reduce the incidence of brain injury and death through increased helmet use. Of course, the stock epinephrine pilot was last week. It was launched, and this, for anybody who missed it, this was an initiative where We became one of the first in North America to have these sorts of epinephrine auto-injectors available on a stock basis within Jackson Square as our initial pilot partner. And I have to tell you, the trainer who was there from Anaphylaxis Canada was talking about the mall security guards and just how fantastic they were with this training and just how engaged they were with it. And they've just done a fantastic job of being prepared. And of course, we're looking at this as a pilot. Look at how does it work? What does it mean? Out there working with McMaster and Anaphylaxis Canada, and then we'll look at where to go from there. And one other application that we made was around the Healthy Kids Community Challenge. The Healthy Kids report came from the province and had 3 main objectives: to start all kids on the path to health, to change the food environment, and create healthy communities. And we were notified just late last week, as you saw in the update that came out, that we had indeed been a successful applicant for those funds. We still don't yet have the details of what that's going to mean in terms of funding, but we have now got, know that we will be able to move ahead with the 3 wards, wards 6, 7, and 8, to implement this within those areas, and we'll be looking at that over the next little while. The first theme will be chosen between nutrition, physical activity, and adequate sleep, and move forward in October or November. There were a few awards along the way. Just to brag, we were, our Nurse Family Partnership was the first team to win the City Managers Awards when they were launched in 2010. And it was a fantastic opportunity. And these awards that have been put in place, and the Mayor comes regularly to those and says a few words, they have just been a terrific motivator for staff in the recognition of the kind of work that's been done. The Air Quality Task Force has had a couple of awards, one from the American Planning Association around the work that was done, and then as well the Climate Change Charter was recognized by the Federation of Canadian Municipalities, and we've just heard this week that it's won another award from the American Planning Association for Sustainable Communities. So we're doing something right to get all that American attention for our work. Had a couple of Week of the Child Award recipients. So this is Ashley Zecca, who was one of those, and you'll see another one in just a minute. But Heather McCulley is one of our staff. We talk about the tobacco programming, and she's been a major architect behind the youth work that has been done within that program, and she was recognized by McMaster as with an alumni award for all of that work that she has done. This is our second Week of the Child, the 2012 recipient, Jacqueline Grodecki, who's pictured here as well. So this puts us in a nice position in terms of moving forward. We've got our offices consolidated, or at least we'll have the last piece finished with the MAC move by February, we're hoping, right, Teresa, of 2015. The alignment with the city strategic plan, I think we did, as an organization, we kind of knew what the importance was of a strategy, but we're truly in a different place as a whole organization and as a department in terms of alignment with those goals and with the cultural pillars. And I think you'll have noticed throughout the presentation that they're lining the bottom of our presentations, and they're truly being adopted in terms of how we feel about our work, how we act within the organization. Moving forward, we've been talking a lot about where we go with our 2015 planning, and some overarching principles we've been talking about. One is that if public health and the Board of Health is the best person to do it, if we do it best, we need to do it. And so a lot of those things around communicable disease control, health protection, emergency planning that we do, those are things that are core for us. But if we're not, find someone that can do it best and support them. And so that's where this Health Links initiative and other systems planning and integration initiatives are so important. And so if we recognize an issue, how do we, rather than take it on and do it ourselves, how do we work with others like Paul, like the neighborhoods, like the community partners? And you'll have seen that theme of community partnerships all the way through the presentation. The other piece is about working on where you're going to have the greatest impact. And we often talk about this. And there's a great diagram, which we haven't included here, that comes from Nova Scotia that talks about the amount of effort required for how much impact, and that health education initiatives don't have the greatest impact. That initiatives that involve direct client care, they're important, but they only impact one person. And so to move to, for public health in particular, to providing those policy health determinants of health approaches, as you've seen us talk about throughout this, is such an important part of our work. So in terms of other principles, to do the work that in a community and client-centered way, keeping with what you've just heard about from HealthLinks, we do have to do the work that's required by regulation, to continue to try and influence policy and put in place policies, healthy policies where we can, and they're under our control, and to continue a continuous quality improvement or quality assurance approach to our work. Health system integration is a key part of where we think our business will be in 2015 and beyond. So working with systems partners to look at how we can integrate better and how we can facilitate change. And it's a totally different environment now, 4 years later, than it was in 2010. When you look at what was presented to you today, when you think about the initiatives that are underway, it truly is a different place, and we need to make sure that we continue to be a part of that and to push that piece of it. The major health challenges that we need to address. Healthy kids, of course, remains a key part of it. So physical activity, food, as you heard about, all of those elements. Our food strategy, making sure that people have access to sustainable, safe, adequate food supply. Mental health and well-being is a key part. As you've seen in those slides from HealthLinks, it remains a significant issue, and so we need to continue to think about what does this mean for all of us going forward and how can we address it differently. The healthy birth weight strategy will continue to be a significant piece. There's some other initiatives. 2015, of course, is going to be the year of Pan Am for us. And for us in public health, as you'll hear about in just a minute, that has particularly important implications. The built environment and mobility, transportation, I know Chris talked about those yesterday, going to continue to be a major part of it. Air quality and climate change as well. I think in those initiatives, it's going to be mostly a building and underground, like behind the scenes work with some really major pieces coming out in 2016. We have some internal work to do as well. The administrative review that was promised when we moved in and consolidated together will be complete very shortly, and we'll be looking at changing very much how we do our business processes and those sorts of things within the department. Records and information management is also a significant issue for health services. You talked a little bit about lab results and people obtaining access to them, but also from the standpoint of how we handle information. And there's been more and more a move towards electronic systems, and unfortunately that's something where we need to move further ahead with. And over the course of the summer, with both in some of our planning and in some of our reviews, we realized this really needs to get moved up to a higher priority on our list. And so we're investing some resources. As you heard, we did a file review looking at where we could make improvements. And we're going to be investing heavily in this over the next couple of years, and we're going to be bringing forward capital requests to assist us with that. The Denison organizational culture, as Chris, I'm sure, talked about, and as you see here, continuing to work with our employees so they feel that they are the engaged, empowered employees that we all want them to be, and that this is an engaged culture that we work in. So to finish up, our thank you to the Board of Health during this term from staff. We thank you for your leadership. We thank you for your advice. We thank you for your engagement. I have to say this past year has been very different for us in terms of how councillors have been coming to us and working with us, and we very much appreciate it. It's that sort of engagement when we talk about Board of Health governance that we think is crucial so that we can do our work well in the service of the community. Thanks as well to all of our staff, the 470-odd people who do this work day in, day out, and support our community to be as healthy as it can be. And we'd like to ask you all at the end, if you can, to take a picture with us before you head out, but we'll leave that till the end of the meeting. Mr. Mayor, thank you.
Thank you. I don't see any questions. I do. Go ahead, Councillor Partridge.
Yes, thank you, Mr. Mayor. Elizabeth, congratulations to you and your team. You've certainly accomplished a lot this term of council, not to mention the 202 staff reports, which we thank you for very much. But I do have a question through you, Mr. Mayor. In the very beginning, you said some of the accomplishments in 2010, the locations were 18. 2014, I think your reference was we were down to 7 or 8. Do we have any idea, and perhaps this is more for Mike Zagarek, although I don't see him here, what cost savings has there been? How much has that decreased our spending?
So when we look at that piece over time, one of the challenges was that the quality of the space we were in was problematic. That's why we were having some of the challenges we have. And you remember through the GIC meeting, some of the discussions and that went on through that. It was not designed to be office space. And so one of the challenges was that actually the space that we're moving into costs more than the space that we were in, spread out in different locations. It was inherent in addressing some of the issues was that space would cost more. We committed as part of that process to find the difference. The difference was about $470,000 between the two, and so we have been underway over the last several years with many of the reviews that we've done to find those things. To date, I was just asking Helen Klump, who's our manager of F&A, because I couldn't remember from last year, and we haven't gotten back to it yet. We've saved at least $120,000 so far, and over this going into 2015, we will continue to save funds, and through into 2016, when it all comes online, to have met that goal of $470,000.
Okay, so thank you through you, Mr. Mayor. If I understood correctly, we have far fewer locations. However, due to the quality of the space that we needed, the cost has gone up. We should have looked after that amount of money.
Through you, Mr. Mayor. Indeed, year by year, we're cost neutral, just as they roll in. Yeah.
Okay, thank you.
Councillor Collins, take the chair, please. Just briefly, everyone has probably heard of the Franklin expedition and the discoveries that have been made, and still the mystery of why the crew seemed to behave so bizarrely in the cold weather. They could have been saved. Inuits were living around them, and so. But one of the things pointed to is the tin cans that had just been invented at the time, had very high lead levels in them. And since they were ingesting food from these leaded cans, they felt that it may have affected their ability to reason. That brings me to the City of Hamilton's lead survey, which I believe came out in 2011, right? So I was proud that we were able to go through that, and it wasn't mentioned here. But one thing that I find concerning is that we still have on our city website, testing for your tap water for lead is not necessary. If your water service is made of lead, you need to follow the public health advice available about tap water with high lead levels. So I'm a little confused about where we are in terms of the lead issue. Through you, Councillor, Deputy Mayor.
Deputy Mayor, the issue of lead in our older homes remains, in terms of their drinking water, remains a concern. The issue in terms of testing is that testing repeatedly, or testing multiple different homes isn't going to tell us anything new. If you've got an older home with an old lead service pipe, then you've got an issue, and it really doesn't matter whether today it comes in just under or tomorrow it's going to come in just over because the temperature's gone up a little bit, to have that testing done. But to remember that if you're in one of those homes, you do need to consider, if there's somebody in there who's pregnant, if there's young children in that home, that they really should be looking at alternate drinking water or a filter on that tap. And so that issue is still with us as an older urban municipality. It's going to be with us for a while. And, we do also have slightly different lead issues out Councillor Pasuda's way as well with the water in Linden.
Okay, I thought it was a valuable exercise in this term of council. Thanks. I'll take the chair back. Any further questions? Motion to receive. Pearson, Johnson, all in favor. We'll see you outside for a photo right at the end of this session.
Thanks.
And now we'll move along to Brent Browett, Pan Am Public Health Implications.
Okay, I have the distinct pleasure of presenting to you the Pan Am, the Public Health Pan Am presentation, and I also have the distinct pleasure for the city to be providing support to the emergency management planning for Pan Am, and I'm also your municipal liaison once the Pan Am Games started, so appreciate your support in allowing me to represent the city in those particular areas. But today's focus is going to be on how the Pan Am Games will implicate and affect the public health service and how we're going to respond to that. In the spirit of the games, we're going to present to you in a relay fashion. I'm going to be handing off the baton to the other parts of the team, demonstrating the collective ownership of one of our pillars, cultural pillars. So I'm joined by Connie Verhage from Public Health, our emergency planner, Carla McCracken from Emergency Management Planning, and Ellen Pizzetta. Gina Cliff's up in the gallery, and I just want to make special mention of Gina. She's moving on to Cambridge in a similar role. She's going to be the emergency management planning manager there starting in October, and she's done a spectacular job for the city in a number of years on emergency management planning. So all the best to you. I also wanted to say before we get started with the presentation, in terms of a public health response, it truly is a collective whole. So Matt Lawson is, although he's not in the presenting, Matt Lawson is helping us with the heat response, Richard McDonald with food safety, and Kevin McDonald in terms of the tobacco implications of the Pan Am. And at the end of the day, what we plan on providing to you, to the city, the constituents, is that we're a demonstration that collectively, along with the support of Greg Maychuk and Coralie Secor, who are leading the operations of the Pan Am as a host, is that we provide sensational service to the full community. So I'm going to cover for you, this is what the presentation is going to cover: the event information, the emergency management planning, supporting working groups and exercises that have been going on now for a couple of years, the supporting structure for the Pan Am Games, the public health specific planning, and then we're open to any questions that are keeping you up at night so that we make sure that you get some rest. So here's the highlight of the games itself. What we can tell you is that it's the highest spectator attendance of all the games. So Hamilton really does have an opportunity to showcase. The dates that are of particular importance to this community are July 11th to 26th. We're expecting between 10,000 to 20,000 spectators per game in the stadium, and the way in which the tickets are being sold, and if you haven't bought your ticket yet online, you'll know that they just went on sale, so I'd urge you to get your name in and get some tickets. The tickets are being sold as one ticket per day. Most of the days there are 2 games per day that are starting later on in the afternoon going into the evening. With the exception of the first day, there'll be 4 games. There are cultural events that are being planned. Again, Coralie and Greg are leading that up with the support of various groups across the city. Cultural events that we anticipate will occur across the city leading up to and during the games. There's multiple languages and multiple countries that will be present. The various wide spectrum of demographics of spectator athletes and dignitaries, and there's numerous and language cultural opportunities for the games. And now Carla is going to talk to you about the risks.
Good afternoon. In terms of the Pan Am Games, the province of Ontario, through the Office of the Fire Marshal and Emergency Management, has done a comprehensive risk assessment for the Games. Some of the risks that they've identified across the entire footprint of the Games, so please keep in mind this is numerous municipalities across a large geographic area. This isn't Hamilton specifically, but hazardous materials incidents, the possibility of a tornado impacting that large geographic area, some sort of large failure to the critical infrastructure that keeps our communities running, and of course a human health emergency. Local, some of the impacts that we're looking at when the Pan Am Games are here, the greatest risk is probably transportation and traffic incidents. We have a large number of people that are going to be converging on the City of Hamilton while the games are here. Spectators, TO 2015 staff and volunteers coming to the city through a variety of transportation means. Given the timing of the year for the Pan Am Games, we can also be looking at severe weather incidences. So that could be what we've experienced in the past in terms of heat waves. We could have thunderstorms, tornadoes, windstorms, or a large amount of rain in a very short time period that could affect staff, the facility, workers, and volunteers in the area. Some of the other considerations for local impacts include infection control, and there is a robust working group working right now on how that's going to be handled, how surveillance is going to be handled before, during, and after the games. In terms of food safety, we can expect an increase of food safety inspections before and during the games. And one of the important things to keep in mind from the City of Hamilton perspective is that we're in control and we're responsible for everything outside of that stadium. We might have staff and resources inside the stadium, but that falls under the responsibility and the jurisdiction of TO 2015 and the Pan Am Games while they are here and operating. We're lucky here in Hamilton. We have a very strong foundation for emergency planning and emergency preparedness, and that's going to be built upon as we look at the consequence management planning for the games. We have a number of city emergency plans, supporting procedures, and operational documents that we'll be pulling from. We have a 24/7 emergency operations center for the corporate-wide response, as well as a backup location. We're also fortunate to have 3 department operation centers that can also kick up and run in the event that an incident happens here. Our staff are trained annually through training courses as well as exercises. We've actually run over 23 training sessions since 2011 for personnel in our Emergency Operations Center. Our intent, specifically in Hamilton with regards to the Board of Health and the health sector, we have the Hamilton Health Sector Committee. We're very lucky here. This is a committee that not only plans for emergencies within the healthcare sector, but also has a response capability as well. So this is the foundation that we're building upon as we move forward and continue with our planning. Some of the things we're looking at, of course, with the Pan Am Games, there's a whole slew of new governance bodies that are being put in place, not only for planning for the Pan Am Games in Ontario, but also in terms of games operations and emergency management response for the games. So we're taking our current emergency plans and procedures and making sure that we understand the communications and the linkages to all of these new governance bodies that are being put in place. And I'm going to go over that very quickly in the next slide. We do anticipate that the emergency management program here in the City of Hamilton is going to take on a monitoring function while the games are here to assess if things are escalating, if they're getting out of control, if there's a need to activate the corporate emergency plan and emergency operations center. And our EOC personnel are going to be prepared and staffed, ready to respond if needed should an incident occur. Some other specialized areas of emergency planning that we're looking at. We've done a lot of evacuation planning for the city, but of course now we're putting a Pan Am lens to that, looking at the stadium, our potential celebration sites, and potential training sites should we have any. Mass casualty planning has been underway, and of course when that's finalized across the healthcare sector, we're going to be putting a Pan Am lens to that as an appendix to make sure that we have any issues covered off with respect to a mass casualty incident should one occur. So please don't let this slide scare you. I'm going to walk you through it. This is some of the complexity that we're dealing with in terms of emergency planning and emergency response for the games. So I'm going to just walk you through the left-hand side of this to begin with. And this is basically if an emergency happens in the City of Hamilton during the Pan Am Games, and it's not at the stadium, it's not at a Pan Am specific site, we are going to respond as we would normally respond during any emergency. What that means is we have our unified command at site and they respond. We're responding to an emergency site. They are then going to link up into our department operations centers for the City of Hamilton. We have 3, one for public works, one for public health, and one for community and emergency services. They can also link up to the Municipal Emergency Operations Center should it be activated. And through that, we can get resources and assistance from the provincial government and their various ministries, and through them we can link up to the Government Operations Center as well. So now I'm going to turn your attention to the other side of the slide, and this is all of the new things that are being put in place for the Pan Am Games. The yellow boxes are going to be City of Hamilton functions or government bodies that are going to be put in place. Everything that's orange is related to TO 2015 and one of their operational structures. Okay, so if an emergency happens in the city of Hamilton, this is how we're going to link into TO 2015 and the stadium and everything that's going on for the Pan Am Games, whether or not one of those sites are impacted. So we're going to have a direct linkage to our venue command, which is the integrated security unit where fire, police, and our paramedic service will be located, and that will be at the stadium. And then they're going to be our linkage into all the rest of these TO 2015 boxes. So there's going to be a venue operations center, the ISU integrated security unit command for all of Ontario, as well as the TO 2015 main operations centers and the number of other boxes that are up on this slide. The other key connection for us is going to be the Pan Am Hamilton Functional Command Center. And this is a person, a liaison, a linkage into TO 2015 in their main operations center throughout the games. This is going to be not just an emergency function, but a day-to-day operational function for information sharing back and forth between the city and TO 2015 about what's going on, are there any events, and information sharing. And this is going to be the position that's held by Brent Browett or facilitated by Brent Browett throughout the games. Okay, and I think I'm passing off to Connie right now at this point to continue. The answer.
These are the working groups that have been developed over the past. These are the working groups that have been developed over the last couple of years for Pan Am planning. This slide particularly talks about the working groups both at the provincial level and at the local level. All of them taking a look at what is our risk, what is our mitigation plan for bringing the Pan Am Games here into Hamilton. The other purpose of this working group, or these working groups too, is to develop the relationships both at the local level and at the provincial level, so that at the time of a challenge or a need during the Pan Am Games, we have those relationships and we could easily make contact with these working groups. These are the working groups that are specific to public health. There are a number of them. We have the food planning team, which is looking specifically at food safety at the stadium, at the satellite site, and at all food premises within Hamilton. We have our Pan Am Health Sector group, which is really just our emergency health sector group, which is looking at our health sector agencies. So that's our paramedics, our hospitals, CCAC, and our family physicians, all taking a look at how do we need to be prepared for anything that could impact us during the games. There is also our surveillance team, and they're keeping a pulse on any change of surveillance information over the time period of the games. And then there is our healthy living program and or department or division that will be taking a look at both our tobacco control and making sure for healthy living choices, which we'll talk about later. And then there is the LIN Pan Am planning, which is doing planning at the LIN wide as far as being prepared for anything that happens within the footprint of the games. The cornerstone or foundation of any emergency program is exercises and training, and we've done quite a bit of training to date just to get prepared for these games. So in 2013, the Hamilton Health Sector did an exercise on heat, severe heat, and on food contamination. At the provincial level, we've already done an exercise in this spring. They were focusing on everything from security to food safety to severe heat. And then within the city themselves, they've done a fair amount of training to prepare the program committee to respond in an emergency, and just really defining their roles and responsibilities. The training that will be going on for the rest of the year, we had an exercise at the LINS September 11th, and that's just looking within the LINS. We had an infectious disease outbreak and how all the LINS would respond, the health units within the LINS and the paramedics in the hospitals. And then coming up on October 7th and 8th, we have a provincial exercise where we will be participating in a food poisoning exercise and an infectious disease outbreak exercise. And then at the actual stadium at the end of October, the university's national men and women's soccer final will be held at the stadium. So we'll be doing some testing of the systems at that time. And then in November, we'll be having both the city exercise and a health sector exercise just to test our systems. And then moving into 2015, we will be doing exercise. Both the health sector will do exercise in February and in June. The province will do another set of exercise in April, and that's where we'll be sending some city representatives to that exercise. And then the city will be doing their training and exercise in March and April of 2015 to get response.
So, in addition to emergency management, hosting Pan Am has...
Mr. Mayor, just on point of order, I do have to leave about 20 to 4. I apologize.
Excuse me, I plan to bring that forward, okay. Councillor. Thank you very much. Please go ahead, Al.
I didn't want to cause any problems later for you.
So in addition to emergency management, hosting Pan Am has created an opportunity to influence policy and health messaging and behaviors in all the communities, including the City of Hamilton. One of those areas is tobacco control. Toronto Public Health has submitted a tobacco-free games policy proposal to TO 2015 through the Host City Showcase program initiatives. The proposal includes restricting tobacco-related advertising, tobacco-linked merchandise sponsorship, promotion and licensing at the games. Secondly, restricting the retail promotion and sales of tobacco industry products and imposing a complete ban on the display of tobacco products. Thirdly, smoking bans in public places and venue perimeters. Toronto Public Health is leading a multi-public health unit Pan Am 2015 working group, of which Hamilton is a participant. And certainly, Hamilton is been demonstrated as an innovative leader around tobacco smoke-free spaces. So a credit to the tobacco control program led by Kevin McDonald. Hamilton's Public Health Services has recommended the following opportunities through this working group. Firstly, centralized communications and marketing related to the policy should it be adopted. Additional temporary no smoking signage beyond the fixed stadium installations. And thirdly, an enforcement strategy that is developed and coordinated by Toronto 2015 in cooperation with Pan Am 2015 security, local police, and the public health units. A second area of opportunity, and certainly Dr. Richardson spoke about this in the earlier presentation, is the promotion of healthy living with a specific focus on physical activity targeting children and youth. This is very aligned with the Hamilton Healthy Kids strategy, most recently presented at the August Board of Health meeting to address the growing issue of childhood obesity. The Government of Ontario and TO 2015 have created a Pan Am, Para-Pan Am Kids program, which is a collection of resources and activities for elementary and secondary school teachers, after-school leaders, and recreational staff. Our Healthy Kids Strategy Project Manager, along with physical activity, health promoters, and public health nurses working in schools, will be working in collaboration to both promote and support these activities. In addition, recommendations related to shade guidelines have been submitted to the Hamilton Special Event Advisory Team to incorporate into the city event criteria and to support Pan Am legacy for future community events. You'll see a number of initiatives listed on here. Public Health Healthy Living Division staff will continue to work with the Hamilton Pan Am Host Committee on a number of the initiatives listed here, continuing to link physical activity messages and programs to the Pan Am legacy. And I will now turn it back to Brent.
So essentially, this is what we've covered: the event information, the emergency management planning, the supporting working groups, and the exercises, the supporting structure. You heard about the public health planning, and in addition, I need to mention the Hamilton Public Health Surveillance Team. They're also an integral part of the infectious control process that you heard about. And subject to any questions, that's the end of our demonstration of collective ownership with the Pan Am within public health and across the other city departments and integrated with the Pan Am 2015 operations. Thank you.
Thank you, Brett. Now, just for the information of the Board of Health, we are going to lose quorum at 20 to 4. We still have a number of items that have to be dealt with today in view of the fact that this is our last Board of Health meeting, and that would be the Good to Go food box pilot program, the vaccine program update. Well, that's an update, but the appointment of Associate Medical Officer of Health and any motions that we may wish to see go through today. So, in view of that, yeah, we have questioners for our group here. Okay, so let's deal with the. Do we have any further questions with regard? Okay, I have Councillor Duval, and then we can move that.
Thanks, Mr. Mayor, and through you to Brent. Brent, I only know because I know this is going to be an issue, but can you, on the tobacco control highlights, we got public health services, you got 2 additional temporary no smoking signage beyond fixed stadium installations. What does that mean?
Through you, Mr. Mayor. Sorry, can you repeat the question?
Well, you've got additional temporary no smoking signage. We're going to put that out beyond. What does that mean? We're going to go further?
So it's a recommendation that Hamilton has suggested to the working group to add additional temporary signage. This hasn't yet been approved. Certainly, Kevin, if I can call upon Kevin McDonald to specifically identify what specific signage was being proposed.
Okay. And are we going to have a smoking area for our guests that come in? People will smoke. And I don't want Sir to get in tickets for coming into Hamilton because they're going to do it, but we have to have something that the people that do.
Through you, Mr. Mayor, I see Kevin is ready to answer the first question. I'll ask him to speak to the second one as well. Thank you.
Through you, Mr. Mayor, and thank you very much, Councillor Duval, for the question. Your points are well made, and those are the concerns we've expressed to our partners in public health across the various Pan Am jurisdictions. Our view is that we want Toronto 2015 to be the coordinating body if such a policy is adopted. So visitors, athletes, media, fans, all have the same rules regardless of where they're seeing a game within the Pan Am district. And so our recommendation in terms of adding additional signage apply to all of those jurisdictions, which is we anticipate and we know that a number of guests will be coming from out of the country. They won't know what the rules are, and that's why we also recommended a coordinated communication effort by Toronto 2015. When you look at Tim Hortons Field, my understanding from our colleagues in Public Works is that permanent signage will be installed this coming spring at the location outlining our bylaw. That being said, we have recommended that we would not be actively enforcing against our municipal bylaw in there if Toronto 2015 has adopted a universal policy for tobacco-free games. So additional signage would be raising awareness amongst visitors to that particular district so that they're aware of what the rules are. We also suggested that they look at a coordinated enforcement practice that would emphasize warnings and potentially ejection depending on what Pan Am 2015 felt was warranted. I'm not aware of any plans from Toronto 2015 at this time as the operators of the stadium to provide a smoking area within the fence of the stadium.
Okay, thank you. Thanks, Mr. Mayor. So I just want to, as a suggestion that please keep these people in mind. They will, and they have to go someplace. So there's an issue that has to be dealt with, whether we don't appreciate it or not. There will be people out there.
Right. Thanks, Councillor. One more thing. On the October 7th food poisoning exercise, I'm going to nominate the absent members of the Board of Health to participate in the food poisoning exercise. Do I hear a seconder? Councillor Marula, you have a motion to receive?
Moved by myself, seconded by Councillor Collins, that we received the presentation, and many thanks for your thorough report. Thank you.
Thank you. All in favor? Carried. And I'm sure that we'll be able to address in more detail, long before the games begin, Councillor Duval and other issues that are brought up. May I suggest to the board that we move just quickly now to the vaccine program update, if there's no discussion on that. Okay, Partridge, Marula, all in favor? That's carried. And then we have 8.2. Moved. Do you have a seconder?
Yeah, moved by Councillor Collins.
And your comment?
And just quickly, I want to thank staff. It's related to the pesticides and honeybee population issue. I still believe that we weren't as aggressive as we should have been, but having said that, we did find a compromise with our rural members and community, and I look forward to the report, but I think it's one of those issues that, although it doesn't gain any traction from a public perspective, is really significant in impact from an environmental and other perspectives, particularly our food source issue. So I do want to highlight the importance of this, even though most people have no understanding of the significance of it. I think we should put it accordingly. So I thank you for your support in advance.
All right, so that's moved and seconded. All in favor? Carried. Now we have the 8.3, the appointment of Associate Medical Officer of Health. Moved by Marula, seconded by McCaddy. All in favor? Thank you. Now we're going to come back to, and once again we'll lose our quorum at 20 minutes to 4. So which presentation? Yeah. So we have the delegations. Yes, Councillor McCaddy.
Sorry, Mr. Mayor, just a procedural question, just in case we don't get there, and good chance we won't. Just there's a couple of motions still. Do we have a procedural option to refer the motions to council? I don't know, in case we don't get to them today, because they would just die, I guess, if we didn't get to them. Maybe that's a question through you to our clerk.
Councillor Marula, do you have some advice on this?
Mr. Mayor, just on the gasification process, everyone knows how I stand on it. Councillor Morrow was...
Well, excuse me, Councillor. Councillor McCaddy's got a
procedural question. Just
I thought you were talking about the motion.
A procedural
no,
question.
not specific motions.
So can these motions go as they are to council without direction from the Board of Health? So the motions have to be written into the agenda of the council meeting of the 22nd? 24th.
So we don't, Mr. Mayor,
so we can proceed. We can have the discussion with regard to the motions at council. Okay, so yes, Councillor Marula.
Just on points where perhaps we can expedite it. I know that Councillor McCaddy has a motion surrounding the food box. I think we have an understanding and agreement. If you want to bring, he could bring that motion forward now. The delegations here, and I think they're in concurrence with the motion.
That's right.
If the delegation request will accept that. Also, with respect to the gasification process, I know, as I was going to mention earlier, with respect to Councillor Morrow's position, I think this is a significant issue that needs to be dealt with. I would prefer to deal with it now, but I think in all fairness to the candidates running in Ward 3, it is an election issue that needs to be dealt with. I'd prefer to defer this motion in consultation with Councillor Morrow for the next council to deal with accordingly. So that's my input on the motion issues.
All right, so we have agreement around the table on that. So we could do that right now. The gasification motion, you move that it be referred, seconded by Collins. All in favor? Carried. Thank you. So now we're going to come back to delegations. And in fairness to the folks who are here, thank you for your patience. And so I'm going to suggest that we go as quickly as we can through the delegations, but and Dr. Tran also has to present, or at least has a presentation ready. So let's hear from the delegates first. And so now I'll call on Sally Palmer to the podium. Sally? And then Elizabeth McGuire, Tom Cooper, Susan Muma, Myrtle Grieve, John Mills. I find it difficult to believe we're going to be able to get all through the delegation, so you'll have to forgive me for that. At some point, we're going to have to call for the motion, for the recommendation, that is. So please go ahead, and please get right behind the microphone.
Thank you, Mr. Mayor and councillors.
Right behind the microphone.
Thank you, Mr. Mayor and councillors, for allowing us to speak today. I'm Sally Palmer, and I'm speaking for the two committees mentioned in the red letters, Social Action Committee and the Nutritious Food Plan Committee. And we agree with the recommendation in the staff's report to use the 18,000 remaining in the Good to Go food box, working through food banks to continue a fresh produce supplement for people in need. And we also agree with the recommendation for a 15-month extension, which is in the report. But we disagree about this 18,000 being used for food bank clients in general. We believe that the produce made available through the 18,000 should be reserved for single people receiving Ontario Works, as they were the intended beneficiaries of the existing pilot project, and their situation is desperate. So what are the costs for a single person on OW? Their total benefit, including tax credits, is $738 a month. Then you can see that average rent is $543 a month. That means that all other expenses have to be covered by $195 a month. And in judging that it's 4.3 weeks in a month, it comes out that they have less than $45 a week for everything else. How can they possibly buy food on that amount of money? So the history and results of the Good to Go food box you'll see in the report prepared by the Public Health Services. Just very briefly, it started in 2012. The Board of Health and the Roundtable set aside altogether $65,000 for the project, and many benefits flowed from it. There are two testimonials here. One is CG, a man in his 40s who lived on Ontario Works for 2 months, said it was very delicious food and an excellent supplement to the diet he could afford on an Ontario Works budget. He felt healthier when eating the fresh food, and he got back to work. Then there's a testimonial from Mary Nelson from Mission Services Food Banks. Our clients are going to be the recipients of beautiful fresh produce, and the next day you won't believe how excited they have been to get these items. Okay, sorry. There is an issue raised in the report about the feasibility of providing the food just to OW singles through the food banks. The restriction to OW singles is limiting, but it should be feasible. And in fact, the report makes that point itself. That 3 food banks who are under Hamilton Food Share have already been doing it this way for the past 18 months with the Good to Go food box. Here's a couple of cases of people who benefited. One was Wayne Lively. He had a triple bypass. He's been waiting for 18 months to get on ODSP. He finally got on this summer. He said about the food, I felt I was putting something good into myself instead of just sandwiches. Then there's Jim McLean, who some of you would remember. He came last October to talk to this group and said he felt healthier when eating fresh produce. He was going to speak today, but he's back at work after about 18 months off. This is Deb Matthews, as you know, who's presently in charge of the Ontario Poverty Reduction Strategy, and she made this statement a long time ago, back in 2004. People relying on social assistance are desperately trying to survive. Finding stable housing, enough food, can exhaust all their energy with nothing left for training and job searches. The next comes from Laura Katari, community advocate, who's actually here with us this afternoon. She said, singles on OW rely on food banks because after rent and hydro, there is little to no money left. If they're lucky, they have enough for 2 weeks of the month.
Sally, we're coming up to time.
Okay, we must not abandon our poor citizens because of the challenges encountered in the Good to Go food bank pilot program, and I've already said what our recommendations are, that we agree, except that we want it to go to OW singles. And in fact, in the report, option 3 on page 11 goes into that, and we agree with that, option 3. Thank you.
Thank you very much. And now I'm going to call, no questions, call Elizabeth McGuire to the podium. And Tom Cooper, I know you're here. Oh, I thought, oh, you're going to do Tom. Right, I saw him before, okay. Hello, go ahead.
Hi. Mr. Mayor, in view of the number of other delegates who would like to speak, I'd like to give up my time to one of them, if that's all right.
Well, thank you very much. That'll help us as well. And so that will bring alias Tom Cooper to the podium.
Thank you. I always hope when I stand in for Tom, I'll be a little taller, but it never happens. My name is Laura Katari, and I'm chair of the Social Assistance Reform Work Group for the Hamilton Roundtable for Poverty Reduction. Hello again. Nice to see you. I want to start first by just saying thank you to the Board of Health, to our public health department, the committees, and all the volunteers that made this pilot project happen. It was fabulous in terms of a learning resource, if nothing else, to know how best to serve our community. With the roundtable, we do not have any consensus in terms of recommendations, what's being put forward to you today. There were varying opinions as to what should be done with the remaining funds. What we did agree on was urging the Board of Health once again to contact the province and insist on an increase, especially for those on Ontario Works who are single. They really do need more money, and we will continue our fight with that, and we hope you as well will contact and let them know. And last but not least, whatever decision you make, to keep in mind the dignity of all recipients in moving forward with any plan. Thank you for hearing me.
Laura, thank you very much for your presentation today. Susan, you moving through some mall? Okay, please go ahead. And Myrtle Grieve will be next, and we'll receive all the presentations at the end.
Thank you. Good afternoon. I'd like to thank Mayor Bertina and the councillors for hearing me this afternoon. My name is Susan Muma, and I am the Secretary of HOPE, Hamilton Organizing for Poverty Elimination. Sally Palmer is also a member of our group. As you know, Sally was the mainstay behind the Good to Go food box, and I have been delivering this Good to Go food box for her since last fall and during last winter. I deliver it to people who are unable to get out to collect the fresh fruit and vegetables, and I can tell you that those I have delivered it to have expressed their appreciation every time for the quality produce they've received. You may wonder why those who cannot get out to collect their Good to Go food box are recipients of Ontario Works. I've often asked myself that question. How is it possible that people who are not able to get out to collect their food can be deemed able to work? The difficulty of getting ODSP, Ontario Disability Support Program, seems to be the answer to that question. From my involvement with HOPE, I have met a number of people on Ontario Works who should be on ODSP. I know this is a question that concerns many groups in the city, and I don't have the answer. I would suggest, though, as I'm sure these groups have, that in the long term the government would save time and money if they made access to ODSP more accessible, timely, and less restrictive for those who need it. To return to the Good to Go food box, according to Hamilton Public Health Services report of 2013, Is Healthy Food Available for Everyone in Hamilton? Income is one of the best predictors of health. People living on low incomes are more likely to experience depression and disease. The worst off of these low-income people is the single male on Ontario Works. The total amount of money received handicaps him in his ability to eat a nutritious diet. He still has a shortfall of close to $70 in 2014, and this does not take into account the increased cost of food. And food is one of those items that certainly has increased and continues to increase in price. In an attempt to try to improve the nutrition of singles on OW, the Board of Health in the city, with a contribution from the Roundtable, developed a pilot program called the Good to Go Food Box. The Good to Go Food Box supplied single people on Ontario Works with a bag of fresh fruit and vegetables on a monthly basis. The bag cost $10 per client and was distributed by some food banks or delivered to recipients who are unable to get out. For several months now, I've delivered the Good to Go food box to 2 older women who live in Stony Creek. They live in a rather isolated area, and their street has been torn up since I began deliveries. Last time I delivered, I had to climb a rather steep embankment. It was high enough that I had to jump off it when returning to my car. Eventually, their street will be repaired, but it's still out of the way, and transportation is a fair distance away, especially when you consider the age and health of these 2 recipients. There is $18,000 left from the Good to Go Food Box pilot. I am here today to urge you to use this money for its intended purpose, to provide fresh fruit and vegetables for singles living on Ontario Works. I believe there has been a suggestion that the money simply be divided among food banks in the city. The $18,000 should be distributed to the food banks, which are able to organize the distribution of a bag of fresh fruit and vegetables to singles in Ontario Works. I understand that if this is done, the money can last for up to 6 months, during which time singles on OW will continue to receive the fresh fruit and vegetables. Since the money was originally intended to improve the diet of the most vulnerable among us, I feel very strongly that it must be used for its original purpose. I understand that there were food banks supplying the Good to Go food box to singles in OW. If these same food banks were to supply the fresh fruit and vegetables to the singles until the remaining money is gone, it would be fair. Otherwise, it would be unfair. I have learned since I wrote this that the Board of Health has suggested another pilot which would last for 15 months and supply fresh fruit and vegetables to all food bank clients. While I applaud this move, I still believe that the money remaining from the Good to Go food box should be used for its original purpose. Rather than simply allowing the money to go into general revenues for all food banks, I would prefer to see the city put the money aside so that members of the Good Nutrition Committee might appear before the new council to argue for the continuation of a Good to Go food box or an alternative to it. The $18,000 could be the seed fund for a new or continuing program to ensure better nutrition for singles on Ontario Works. It would be even better if we lived in a time and place where we had no need of food banks, where everyone had enough money to buy what they needed for a nutritious diet. Maybe one day we'll get there. Thank you.
Susan, thank you very much. I appreciate your attention to the time. And seeing no questions, we'll move to our next speaker, who is Myrtle Grieve. There you are. Go ahead, please.
Thank you. I'm going to abbreviate my presentation and try not to say things that other people have said. Okay. CFUW has been in Canada since 1919, and we work to improve the lives of girls and women and to promote human rights, public education, social justice, and peace. And I think this falls into all of those categories. We are also one of the organizations asking the province of Ontario to increase the payment to OW recipients by $100 a month so they can purchase good food for themselves. But until that happens, we support the provision of fresh produce supplement to the food received at food banks by these individuals. I think there's a person in this room can imagine living on $626 a month. If you have to choose between paying your rent and buying food, food will be the first to go. Of course, recipients receiving good fruits and vegetables feel better. We all pay when our fellow citizens cannot work or participate in community life due to poor health. On behalf of CFUW, I am endorsing the recommendations of the Nutritious Food Plan Committee for the $18,000 remaining in the Good to Go Food Box Fund to be used for OW singles only. Thank you.
Thank you very much. So members of council and those who have come to present as delegations, we are going to have to go to the recommendation. I'm sorry. We're going to have to go to the recommendation. Otherwise, we will not be able to deal with the recommendation. However, the recommendation will not be finalized until it comes before council on the 24th. So what I would urge the presenters, John, Katrina, Dave, Deirdre, and we do have Peter Hutton's written presentation, that you put your thoughts to paper or email and send it to either the clerk, and we will distribute that among the entire council, and they will be able to take that into consideration on the vote that will occur on these recommendations for the council meeting of the 24th. I apologize for that. We're in the unfortunate position of having to move forward, but it does not mean that your input will not be taken into consideration for the ultimate consideration of the recommendation that's before us. So I apologize for that, but that's all I can do. So, Madam Clerk, would you please be sure that you circulate any written submissions to members of the Board of Health prior to the council meeting on the 24th. Councillor McCaddy.
Mayor, given the quorum challenges we have and the direction you've just provided, I would move the staff recommendation 7.4, seconded by Councillor Collins. Okay. And I'll speak to it briefly. Councillor Marula and I have worked on this for a number of months with both community services and the public health department, Dr. Tran specifically. And we've been tracking how this has been going. I'd like to first of all thank staff for working on this and thank all the folks who advocated for this to get it here in the first place, and thank Environment Hamilton for the work that they did on this project as well. As you can see from the information here, it hasn't worked out perfectly. It's a challenging project, and there are high administration costs and other challenges. So the recommendation is to take the remaining funding and to keep the project going, working with Food Share, who supply to 11 food banks throughout the city. And on page 5 of the report, the reference to the OW singles, we've heard from many people, rightfully so. That's what this project's about in the first place. The focus will be to distribute to the latter half of each month. And although that doesn't specifically target OW recipients, at least as what we're talking about today, that's been identified at a time of month when OW recipients typically use a food bank. And there may be individual additional arrangements that can be made with the food bank. We're moving this today, but the devil's in the details, and there may be additional work that can be done. And then to refer the continuation of this project, and I think that's where the additional discussion needs to take place, to the 2015 budget, and for a 15-month extension, which would take it to July 2016, and certainly wide open to additional comments and thoughts on how that could best be accomplished. So it hasn't worked out perfectly. It did serve a number of people, though. We've heard this afternoon, and I've heard from previous discussions. So thanks to staff, and that's the direction that I think at this point in time we need to go in.
Thank you. Councillor Partridge.
Yes, thank you, Mr. Mayor. And the only concern I have about this is how Waterdown Food Bank and Flamborough Food Bank are going to be impacted. So through you to staff, because I don't see a list of the food banks in here who are going to be recipients, could you please speak to the impact on OW folks in Waterdown, please, and Flamborough in general?
Through Mr. Mayor. So in the presentation, it maps out the sites of the current Good to Go as well as the food banks within the food share model. There are a couple regions, Flamborough and Lower Stony Creek, that aren't captured in the 11 food banks. We had put into the discussion that we could pursue those areas and working with specific partnerships with those food banks in those areas that are not part of food share to make this the new pilot program more inclusive of wards such as Flamborough.
All right, thank you. And if I need to move an amendment to ensure that the Waterdown Food Bank is included Yeah, like have you talked to them at all? Has anybody even reached out to them to talk to them?
Through you, Mr. Mayor, we have not, but we can do that. I would consider that a friendly amendment.
Okay, because they are a member of Food Share, so I don't understand why you didn't talk to them.
So, Councillor, in view of the time, I'm sorry to interrupt.
Yeah, and I don't mind. I can do that offline.
Let's deal with what we have in front of us, and then you can bring those.
Well, I'd like to do the amendment first, if I may.
Well, you could, but you could also do it at council on the 24th.
No, I'd like to do it now.
Fine.
I want to ensure that it gets included.
Friendly amendment, moved.
Friendly
seconded.
amendment.
Councillor Johnson, all in favor of the amendment?
Thank you.
That's carried.
Carried.
Now, before we go to the full motion, I'd like to have a motion to waive the presentation. Marula, McCaddy, all in favor? Carried. And on the motion, Councillor McCaddy, Councillor Collins?
As amended.
As amended. All in favor?
Thank you. Carried.
Standing recorded vote? All in favor?
As amended.
As amended. And we see unanimous for all those present in the chamber. Thank you. And that concludes the business that we have, so I'm going to call for a motion to adjourn. Councillor Pearson, Councillor Johnson, all in favor? That's carried. We're requested to take a photo outside right now. What? Supposed to be with this staff.